Good afternoon, and thank you for joining PQA for today's Quality Forum webinar. My name is Richard Schmitz. I am PQA's Senior Director of Communications and moderator for today's discussion on Pharmacists Expanding Scope of Practice. Are we ready? Before we begin, three quick housekeeping items. Please submit your questions for today's speakers using the questions feature located on the webinar control panel. At the end of today's presentations, we'll cover as many questions as time permits. This forum is being recorded. A copy of the presentation, the slides, and audio recording will be available through the member portal on PQA's website within a week. We also have a brief survey for you at the end of today's webinar. We are particularly interested in your ideas for future webinars. A couple of quick save-the-date reminders. The next Quality Forum is August 8th. That event will dive deeper into PQA's recent Pharmacist-Provided Care Action Guide, and we may also have some reactions to an anticipated GAO report on medication synchronization, which may be issued later this month. And then looking ahead, mark your calendars for November 20th to the 21st and the PQA Leadership Summit. So with that, we'll jump into today's topic, Pharmacists Expanding Scope of Practice, Are We Ready? Our presenters are Jill Corso McNabb, who leads Marketing and Product Management for Pharmacy Profiles. She is a proven leader with progressive success in marketing, channel strategy, product management, and strategic planning in technology, healthcare, and nonprofit sectors. Todd Dankmyer is Managing Director of Pharmacy Profiles, a subsidiary of the American Pharmacists Association, a data services company that provides comprehensive, trusted, and verified repository of the nation's pharmacist providers. And Brad Tice is Senior Vice President for Pharmacy Practice with Aspen RX Health. He is the current APHA President and previously worked as the Director of Medication Therapy Management for Cardinal Health. So I will turn things over now to Todd to get us started.
Good afternoon, everybody. Thanks for joining us. We're pleased to be here today. Jill and I will take you through a number of slides, giving you an overview of pharmacists' expanding scope of practice, some of what we see as the needs and requirements associated with that, some of the progress being made, some of the challenges that are still out there, and ways that we think we can address that. And then we will ask Brad Tice, who works with us closely on behalf of Aspen RX Health, to show you a case study of how pharmacists' expanding scope of practice is actually being put into action within that organization.
Richard, we can't forward the slide.
Okay, if you wiggle your mouse, it should give you control.
All right, we got it. Thank you.
So just as a level set here at the outset, this slide kind of sets the stage, if you will. So the goal with the continuing expanded scope of practice of pharmacists is basically to unlock the full potential of pharmacists as trusted healthcare providers and members of the healthcare team. Many of you, on this call today already know that there have been numerous studies over a number of years documenting that by utilizing pharmacists in roles beyond dispensing medications, that we can both enhance the quality of care and contain costs. So the documentation and the studies are there. We're beginning to make progress. There's a long way to go, but there has clearly been a lot of activity and momentum, which we'll talk about today. And the ultimate outcome is better care for patients. So to begin to unlock the pharmacist's full potential, essentially has these building blocks, if you will, or the foundation of all this, as in those blue blocks you see at the bottom. As you're probably aware, there's a whole lot of activity legislatively and through regulatory activities, statewide protocols, changing scope of practice within the State Board of Pharmacy Practice Acts, et cetera. Lots of activity across the United States that is facilitating pharmacists expanding their scope of practice. Pharmacists themselves have to take the initiative to expand their scope. The pharmacy organizations need to take the lead in utilizing pharmacists more creatively and expansively. So that is beginning to happen. There's a lot of activity, but again, we have a long way to go. And to accomplish all of this, there needs to be an acknowledgement of the fact that pharmacists will need to be credentialed. They will need to verify those credentials. And so there will need to be an infrastructure, a platform, if you will, that makes this easier for all the stakeholders within the system to ensure that the pharmacists that they're utilizing more expansively beyond dispensing have the skill sets they need to have, and that they can document that the pharmacists actually have those skills. So this is kind of the core level set of what we're going to talk about today. And with that, I'll move forward. Pharmacy practice is changing rapidly, as we all know. If you look at the top left there, lots of activity with regard to healthcare provider status, lots of different meanings for exactly what provider status means at the state level. But it's a key building block for expanding scope of practice for pharmacists. Lots of activity, as I mentioned, with regard to other kinds of state laws and regulations. Optimizing and modifying state practice acts to give more authority to pharmacists to provide services, freestanding laws that empower pharmacists to participate more broadly, changes in Medicaid regulations, et cetera, et cetera. There's a plethora of activity and continuing momentum to change these laws and regulations to enable pharmacists to provide additional services. The goal of which, the first two, is essentially to expand the patient care services that pharmacists are authorized and eligible to provide. This is, of course, the key to all of this. Associated with that activity, as you go to the right of this circle, is essentially the fact that pharmacists will need to be credentialed within healthcare organizations like hospitals and health systems. They will need to be privileged to provide certain specific services. Those credentials that they have will need to be verified, and they'll need to be verified by authorized third-party sources. The data is going to will increasingly need to be verified and not just self-attested, but verified by additional industry sources. So with these opportunities are both challenges and rewards. So as you look to the left there, pharmacists and others that work with pharmacists will need to learn how to manage their credentials, manage the credentials of pharmacists within their organizations. They'll need to be able to ensure that pharmacists are actually eligible to provide the services that they are now authorized to provide. They'll need to monitor in an ongoing fashion all the statewide protocols, advanced practice strategies, and regulations. This is a large assignment for even the largest organizations with a footprint in all 50 states to keep track of all the changes in the laws and regulations and what it means for pharmacy practice. Mitigating risk is key to all of this. The pharmacists need to mitigate risk. The organizations that employ and contract with pharmacists need to mitigate risk. And as pharmacists gain greater authority to provide more services, their risk will increase. And so the importance of mitigating and monitoring that risk becomes increasingly critical. To accomplish a lot of the promise associated with expanding patient care services, pharmacists need to learn and adapt and adopt documentation and billing systems, learn how to work with existing systems to facilitate their ability to actually provide those services and document it and get paid for them. Lots of rewards associated with all this, of course. It enables pharmacies and other pharmacy organizations to differentiate their services in the market. It enables pharmacies and other organizations expand the niches they're in. It increases beyond dispensing the level of patient care services that pharmacies and pharmacists can provide. And of course, it enhances professional satisfaction for pharmacists across the country. So what's the market look like today? Well, as you're well familiar, generally speaking today, payers contract with pharmacies. They verify the credentials of the pharmacy, sometimes of the pharmacist in charge within that pharmacy. Pharmacies bill directly to PBMs and other payers, and that's primarily for medication dispensing services. That is largely the way the market looks today. As it's evolving and we have more and more activity and scope is expanding, we're seeing that pharmacists are increasingly being authorized to provide additional clinical services. In some cases, pharmacists are earning advanced credentials to support that advanced scope. They don't necessarily have to. It varies from state to state, payer to payer, whether these advanced credentials are required, but in an increasing number of markets and situations they are. Pharmacists are increasingly earning those credentials. Payers are in a position to take advantage of the expanding and cost-effective services provided by pharmacists, and particularly among more progressive payers, that activity is certainly beginning to step up. So how do we support this and help to make sure it happens? Well, credentials are critical to being paid and being eligible to provide professional services. Every other health professional in the marketplace has credentials that they have to document and verify and continue and keep up to date for them to be able to continue to perform as healthcare providers in the marketplace. Pharmacists are no different. As I mentioned earlier, increasingly there will be a need for an infrastructure to help pharmacists individually and pharmacy organizations collectively to manage these credentials on behalf of the pharmacists they either contract with or employ. Employers will require this information, payers will require this information, others will, to ensure that the pharmacists they're working with are appropriately trained and to be able to document and minimize the risk associated with having pharmacists provide these additional patient care services. Lastly, very importantly, these processes need to mirror what is resident in the marketplace today. As I mentioned, other healthcare providers, this is what they do already. They're used to the marketplace of credentials, privileging, credentials verification, and pharmacy is well suited to mirror those processes that are now in place with other providers. Sorry, we'll get there. So this is just an example of a couple of the largest other health provider organizations out there who've been very active in the credentialing and the credentials verification space. The American Medical Association has devoted an enormous amount of resources and time to providing services for physicians in the market so that they can keep their credentials up to date and that they can ensure that they are qualified and eligible to participate in a vast array of provider networks across the United States, whether those are public or private sector networks. This is just an example from the AMA profile. Sorry, these slides are bouncing around. This gives you an example of some of what the AMA does. What's important here is the fact that this lends credibility and veracity to this whole process, that they're leveraging to the right existing industry sources that have been set up to monitor these kinds of activities and these credentials. They leverage that data, they bring that data together on behalf of physicians, which enables physicians to participate in networks and to be compensated for the services they provide. So who cares? A lot of activity there, but why does anyone care? Obviously, pharmacists, it's critical for pharmacists to expand the scope of practice today and to develop additional ways that they can provide services in the marketplace. Increasingly, this will become important for pharmacy technicians as well as the market continues to expand. Just about every other stakeholder in the healthcare system has some advantages to accrue to them from this, whether that's employers that employ pharmacists, whether it's a wide array of networks that enlist pharmacists to participate as providers, wide array of folks that pay and otherwise contract with pharmacists to provide services either in the public sector or privately, and everybody else in the space. Associations, pharmacy schools, pharma, etc. Long list of folks. This is valuable and is increasingly essential for all of them. The slides are bouncing back and forth. Our apologies.
Todd, let me know if you prefer me to move.
Advance the slide.
Next slide, please. So this information is from NASPA, the National Alliance of State Pharmacy Associations, who does great work on behalf of state pharmacy associations and is a great resource with regard to expanding scope of practice and pharmacist provider status. As you can see here, there is a lot of momentum. Pharmacists are recognized as health providers in at least one aspect of state laws throughout the United States. But recognition in and of itself is only the beginning for pharmacists in terms of being able to provide additional services beyond dispensing and to be able to be compensated for that. But obviously, in all the states, there's at least recognition at some level of pharmacists as providers. In 15 plus states, you see that Medicaid has expanded beyond dispensing to enable pharmacists to provide an array of services, including MGM, et cetera. You can see them on the list. All states and other jurisdictions like DC and Puerto Rico now allow pharmacists to provide immunizations. Last year alone, 13 states enacted legislation expanding scope of practice for pharmacists. A number of states allow pharmacists to prescribe and provide the services there you see: naloxone, oral contraceptives, epinephrine, tobacco cessation products, travel meds, etc. And this last bullet, perhaps most compelling of all, in the first 6 months of this year, there are 109 state provider status bills that have been introduced in 34 states. So there is a lot of activity. The scope of practice is going to continue to expand, and we think this is a good thing, but it also carries with us some of the challenges that we've already begun to address here and the need for an organized infrastructure to support all of that. Richard, do you want to get that? Okay. So here's just an example. This is from California. California has provider status, and this is from a provider payment law that is in place. The regs are being implemented as we speak in California. It enables pharmacists to provide the 5 patient care services you see there on the left, but it associates training and education with those services. So you can see from a level of 1 or 2 hours of CE to up to certificate programs and certifications, wide array of requirements associated with being able to provide these services. And California went so far as to actually create an additional licensure category called the Advanced Practice Pharmacist that enable pharmacists to have a broader scope of practice. So this is an example of how there's a lot of information that's going to have to be tracked and supported by the industry to enable pharmacists to realize the opportunities associated with expanding scope of practice. Richard? So for the stakeholders in the market, this is ultimately a bottom line, not surprisingly, a bottom line decision with respect to how they use pharmacists and pharmacies. Can they generate revenue for me, for the plan, for the payer? Can they save dollars? In other words, by utilizing pharmacists more expansively, and can we see savings in the system from the delivery of services? And can we improve the quality of what we're doing? Can pharmacist services deliver a better product and a more optimal product with better outcomes for patients? Richard? I'm going to turn this now over to Joe McNabb to talk to you a little bit about how we'll do this.
Great, thank you. So then the core question is how will we do this? How will we make this happen? Richard, I'll let you do that, thanks. So as we've been talking about the need for an infrastructure to track all of this information, I'm going to give you an example of how we've envisioned this and how we're implementing this at Pharmacy Profiles with some core kind of attributes and requirements that we thought were important given the state of the industry now and where it's heading. So the first thing is a need for a tool, right? An online infrastructure, a web application that's customized to meet the needs of the pharmacy industry. It needs to be very adaptable as the industry is evolving with new regulations and new laws all the time. Obviously, since it's holding a lot of information, it needs to be secure and accessible. A key component, of course, is the data sources and the need for verified data. So if you see across the top of the diagram, the various data sources, Pharmacy Profiles has connected, pulling in the key information from industry-leading sources, places like NABP, the National Association of Boards of Pharmacy, to pull in the licensure, the state boards, to pull that information in, to populate a profile on the pharmacist so that the information can be tracked easily, securely, and really give that robust access to a wide array of data. Next. And one of the key things, of course, tracking the core components of licensure and sanctions is important. But another aspect, as you saw highlighted there with California, was the need for going beyond and tracking additional, what we call advanced credentials. Things like professional credentials, certifications, long-form training, board certification. Pharmacy Profiles has pulled together about 180 different advanced credentials, some which are specific to pharmacists and some that are really shared across the healthcare spectrum. Things like immunization delivery certificate, certified asthma educator, pain educators, things like that. It's important to be able to track not only the acquisition of these advanced credentials, but also their expiration. Many of these will expire and require renewal every 3 years, every 7 years, as the case may be. So it's important to have it as an active, growing list. Next. As we look at the need for infrastructure for the expanding scope of practice, we have three kind of key tenets that we believe are important as the industry moves forward. The first, of course, comprehensive. The system needs to pull all of the information into one place so that the pharmacists, as well as those contracting and employing the pharmacists, are able to track and monitor a wide array of information, licensure, sanctions, advanced credentials. Verification. is another key tenet. Pulling in information and ensuring its accuracy from the source, from the state boards, from NABP, etc. And the last component is around pharmacist-centric. A key component of this, of course, is advancing the role of pharmacists. But the pharmacists play a role as well. As the expanding scope comes to fruition, the pharmacists have, of course, an expanded responsibility as well to participate in the process. Next. Such that everyone needs to be involved, right? The pharmacists have an important role and expanded responsibility to monitor and track their information. And on the other side, this tool, this infrastructure, needs to support the needs of those who are contracting and employing those pharmacists, whether those are employers, networks, payers, and those other industry stakeholders. So we view the need to kind of have two sides in terms of this infrastructure. On one side is the profile for the pharmacist, and on the other side is credentials verification to help employers, payers, and the like verify that information. So let me just dig into that just briefly. Next. So the first is the pharmacist profile. As I said, the pharmacist needs to be an active participant in this process, just as their other healthcare peers are. Not only can they manage their information in one place, they can document their capabilities to those who need to know, to their employers, to those they're contracted with. So this is really important to have the pharmacist involved. Next. So at Pharmacy Profiles and our pharmacist profile, I just wanted to show a couple screenshots of how we've implemented this for the pharmacist. Again, making it easy for them to have this information at their fingertips. So as you see here, this is a licensure page showing that pharmacist with their licensure, when it expires, and you'll see that key information there, it's been verified. So it's coming in from, in this case, the National Association of Boards of Pharmacy to verify that. And then the next slide will show you how advanced credentials can be tracked by the pharmacist. You'll see this particular pharmacist has 3 different advanced credentials. We know when they're expired. They have the ability to expand that and understand more information around the expiration, the credential number, the actual certificate image, and the like. And of course, collaborative practice agreements are another area that certain states are leveraging, and a tool, a comprehensive infrastructure, I think it's important to track that as well. Next. And on the other side, of course, are the employers, the networks, the payers, and other stakeholders. And in terms of their side of understanding the verification of the credentials, of course, that helps them streamline the management of having a core infrastructure and confirm that eligibility to provide the patient care services. You see on the right a screen image. Earlier, we talked about how California is implementing their protocols and having certain requirements associated for Medi-Cal in their provider payment law. There's a lot there for the pharmacist to track. There's a lot there for the employer and the network and the payer to understand. Some pharmacists might have certain requirements and not the others. So it's important that the infrastructure be simple to use, as well as constantly refreshed, right? Constantly pulling in new information, so as things change, that pharmacist then can be authorized to provide a service, or they can go get training to become authorized according to the standards that have been set forth for them. The tracking, of course, is all important about the credentials, but also a continuing education as well. So we're going to turn it over to Brad Tice from Aspen RX, who is one of our early customers at Pharmacy Profiles, and explain a little bit more about how they're handling this particular challenge in their organization.
Yeah, thank you, Jill, and I'm glad to be here today and share this case study of how Aspen RX Health is using Pharmacy Profiles and how it's an important tool to validate credentials. Richard, are you going to go ahead and advance? I'll let you do that.
Brett, why don't you give it a try? There you go.
Okay. Yeah. Okay. So this is our calling statement. The future is calling, and really the future is now. At the same time, as you'll see, as we have developed this, it's really set up to start out being a service that's delivered over the phone. And so Aspen RX Health is the gig economy solution for pharmacist services. It is an app-based intervention platform on an Apple operating system. And so a pharmacist can load this onto their phone or iPad, work over a data plan or wireless connection. And through this, we're creating a two-sided market. So on the one hand, on the left, you see we have the independent pharmacist. That's not an independent pharmacy or independent pharmacy owner. That's an individual pharmacist, in this case, working as an independent contractor. And Aspen contracts for services with healthcare organizations. That could be health plans, that could be really anyone interested in paying pharmacists to deliver services to improve medication use. And we manage the size of that, what we call community of pharmacists, with the number of opportunities that are out there to create a two-sided market to deliver services. And we really kind of sum it up by saying we're the Uber meets Match.com of pharmacist services. The Uber side, just like an Uber driver, can log into the app and see opportunities for rideshare and payment opportunities. The pharmacist can log into the app and see opportunities to get paid for services. The second side, there is not a patient-facing app. It's really the second side of that is the opportunities with the healthcare organization. And in this case, the pharmacist is directly connected to the pharmacist. The pharmacist drives the clinical interventions, and it's really the pharmacist working as much or as little as they choose to, just like an Uber driver. And the Match.com is also where profiles comes in. And so this is where we're also able to drive quality assurance. You see the pharmacy profiles logo there on the first icon on the left. It's a part of the pharmacist onboarding that I'll go into shortly. And so obviously when we are contracting with pharmacists to deliver pharmacist services, we need to make sure that they are licensed and that they are in good standing. And it also enables us to, as Jill mentioned and Todd demonstrated, to utilize that additional information on clinical training, clinical areas of expertise, to pull that in, and then the Match.com fits with matching the clinical training of the pharmacist to the clinical needs of the patient. And so we're able to do the onboarding. At the end of the call, the patient rates the pharmacist on what we call loyalty and endorsement, L&E. Endorsement is your typical 5-star rating of an Uber driver, so to speak. And loyalty is if I have the services the payer is going to pay for on my behalf in the future, do I want to receive them from this pharmacist? And through that, we can develop a connection and a longitudinal relationship between that pharmacist and a patient. And the patient the pharmacist can actually develop their panel of patients over time that they serve, and then have the ability to utilize all of that data for performance monitoring and matching in the future. So on the right, you see what the app looks like, at least one of the screens, and you see the match. And so you see a 75% match here. In this case, it's a bilingual pharmacist who can speak English and Spanish. And we set the criteria of the match on several different factors, including some of those clinical skills and areas that Bill referenced on the previous screen. We can also match it on proximity and other criteria that we establish, and as we learn over time what makes an ideal pharmacist relationship to that patient to serve them better. So this is just a screen of the onboarding process, just to kind of give you a flavor for how we're utilizing pharmacy profiles and what the experience is like to a pharmacist. When they log into the site and create their profile, so to speak, create their login, they come to this screen, and there's a set of onboarding steps. So here you see the welcome screen. There's personal details, areas of expertise, additional information, a voice recording, and then next steps. Once they complete those next steps, they've gone through the onboarding. We have a fee, a small fee to for pharmacists, a one-time fee to be a part of the network. But then you see button number 1 is claim your profile. And here's where we utilize pharmacy profiles to validate that pharmacist licensure. And through this, we ensure that pharmacists are the ones delivering, that they're, again, in good standing, and they're actually licensed in the state that the patient is to provide the services. So they simply click on Claim Your Profile. It goes over to the pharmacy profiles login automatically. The pharmacist logs in. If they don't have an account, they can create one, or they can use their account to log in. And then we simply prompt them to give us permission to use their demographics, licenses, sanctions, advanced credentials, and other CE to populate their profile on the Aspen RX Health site and be utilized in delivering services with patients. And so here you see where the pharmacist has claimed their profile, and then it goes on to the next step. So it's submitting for their background check and establishing the ability to get paid and other paperwork. So really, pharmacy profiles was a really essential tool for Aspen RX Health as it was coming to market. We just launched in April of this year in Florida in a small pilot. We're currently expanding across all of Florida for the rest of this year, and then we'll go beyond Florida in 2020. But it really provides an ability that was necessary for us to be able to ensure that we're using pharmacists that are licensed and in good standing, and to then add in the additional clinical skills and areas of interest to match that with patient care, and again, utilize that to help establish a better, more longitudinal relationship over time. So with that, I'll turn it back over to Todd and Jill.
Thanks very much, Brad. Appreciate it. This is the slide we started with, and I guess we'll revisit it here now. So you can see those 3 core foundations, if we properly engage to ensure that we built the infrastructure to support the expanded scope and the legislation and regulation expanding the capabilities of pharmacists to provide services. That these 3 things together can, in fact, enable pharmacists to unlock the full potential as health providers in the marketplace, and that ultimately that is going to yield better care for patients, which is, of course, ultimately everybody's goal. Next slide. So this is just kind of our final little to-do list to make sure that we've made some sense of all this for you, and to give you a sense for where we think we still need to go and there's more work to do. It's core to think beyond the dispense. All of this is about pharmacist services beyond dispensing. Can't stop working on all the legislation and regulations around expanding scope of practice for pharmacists across the United States, both states and federal level. Recognizing, we hope, that credentials and verification of credentials is going to be key to all of this, and verifying the eligibility of pharmacists to provide those services is going to be essentially an assignment that pharmacists buy into as they expand their scope, and organizations that work with pharmacists buy into verifying that eligibility. All of which is supported by and supplemented by a solid infrastructure that aggregates pharmacist credentials, pharmacy profiles, has taken the initiative and resources and time to build such an infrastructure to support all this, and we hope we can continue to help as the market moves forward. Thanks very much. I'll turn it back over to Richard.
All right, well, thank you, Todd, Jill, and Brad for that presentation. Very informative, lots of information to digest. We have a lot of questions here from the audience, so I'll start fielding those for you to answer. And those of you in the audience, if you have not yet asked your questions, use the window to your right in the webinar module to submit questions. So the first question is, the pharmacy profile is specific to an individual pharmacist, but how does this translate into a pharmacy? For example, if the credentialed pharmacist floats between 3 sites, 3 stores, are there advanced services only offered when the pharmacist is there?
So in terms of the pharmacist profile, it is individual to the pharmacist. But what we do is we connect the pharmacist to their pharmacies, and we do that via NCPDP numbers. And so, for example, if a pharmacist is affiliated with 3 different locations, they would be tagged, if you will, to those 3 different locations. And so if they were obviously the same employer or within the same, the pharmacist would be qualified, or would be tracked, if you will, according to those different locations.
Okay.
I hope that answers.
Okay, yeah. So another question, some states like Georgia, for example, have recently passed legislation that only allows state boards to manage credentials. The writer has a parenthetical that says this was done due to specialty pharmacy, they believe. Are there any discussions with NABP on how this will come into play?
This is Todd. NABP is a strategic partner of ours. We've not had any specific discussions to date with regard to the activities like that in Georgia that you've alluded to. I expect we will, but up to now, we haven't had any need to do so. Probably happen in the future, but not yet.
Next question, can you discuss CLIA waiver test and pharmacy scope of services?
We don't currently track CLIA waivers. That's something that is on our roadmap for adding to the capabilities of the system, but we're not, at this minute, we're not doing that. We have had requests for that.
Do you have an estimation on when that might be incorporated?
Over the next 6 to 12 months.
Now, one thing to add, I talked about the importance of a platform being adaptable and flexible. That's a core component that we've built into the system because we know that it's always evolving, right? So the ability to add new data fields, such as CLIA waivers or new trainings or whatever it might be, is a relatively simple process for us. It's just a question of getting it into the queue, but we recognize that there will always be new things that we need to be tracking. So we've designed the system to make it as easy as possible to do so.
Okay. So what makes this platform valuable?
I would tell you that, a few of the state associations and others have come forward and asked us about CLIA waivers. So we're going there.
Okay. So the next question, what makes this more valuable for the pharmacy community compared to resume sites such as LinkedIn, which are more widely utilized by employers and other non-pharmacy professionals?
This is the pharmacist's own profile carrying a wide array of documented and verified information. There's nothing about LinkedIn or these other sources that I'm familiar with that is documenting anything. We're basically providing 2 tools, one for the pharmacist to essentially to build their own CV on demand within our system, and secondly, for those that either employ or contract with pharmacists to be able to aggregate those pharmacists into their system and know that their pharmacists have the skill sets that they need to provide these services. So the fact that we've built a platform that documents and tracks verified information, and then that we can use that information to empower pharmacists in participating in provider networks and in participating with employers who are expanding scope of practice and through other venues. That's pretty key to what we're doing. I'm not sure how a resume service or LinkedIn really is comparable.
Yeah, Todd, I would just add that there's no way that we could use, as Aspen, could use LinkedIn to validate and ensure that the licensure and other clinical aspects. In case it wasn't clear, this is Profiles is automated. It's connected in real time to NABP and ACPE so that it's pulling that data in on an ongoing basis, and then the pharmacist does have the ability to supplement or add data points in manually. And so this is an authorized, verified source. It's continually updated.
Pharmacists have been traveling down this road for many years without much success. Credentialing pharmacists, et cetera, is realistic and logical. However, our payers, health plans, PBMs, et cetera, truly interested in paying pharmacists for such services. Historically, they have not demonstrated adequate interest. For example, Medicare MTM services and associated PR fees.
The market has obviously reacted very slowly. No one would argue with that. There are all kinds of challenges that we're facing. We do think, I would say, our experience with profiles has been that there are a number of progressive health plans that are asking us, as we speak, for lots of information that is quite detailed and quite in-depth with regard to the skill sets of pharmacists, and are already beginning to deploy pharmacists in different practice settings. So we're a long way from where anybody in the pharmacy profession wants to be, but I think the momentum is in the right direction.
Yeah, Todd, I would just add as well. You mentioned on your slide how many states have introduced additional provider status legislation this year already, and this was created to be ahead of the game and help pharmacists once we do get that. There have also been instances where you can get buy-in to a payer to pay for services, but then I know of at least one example where that group has gone to the credentialing side of the health plan, and that department has stated, we're overwhelmed trying to keep up with our provider physician, for example, traditional credentialing. How can we think about onboarding hundreds or thousands of pharmacists? And this is a way that they would be able to more automate that and remove one barrier to help them get payer buy-in to implementing these services.
All right, I think we've got a series of questions here, Brad, that came in during your presentation. So Todd and Jill, if you guys have things to add, feel free to chime in, but I think these are largely directed for Brad. Brad, is the platform intended for community pharmacists or independent consultants or both?
The platform is intended for any pharmacist that wants to deliver NTM or other patient care opportunities to really focus on medication, improving medication use. So that matching formula, as also mentioned it earlier in the slides, currently opportunities have only been matched to the pharmacy, and there's been limitations to long-term care patients have been difficult to reach. Outpatient hospital pharmacies have been difficult to match because they don't, when you're only matching on previous fills, you can't match to patients. Pharmacists working in ambulatory care clinics. So we see it expanding the opportunities. We know there are thousands of pharmacists in the Pharmacy Moms group, and on Facebook, for example, pharmacist moms working from home that may want to log in and deliver some services and stay in practice. And we absolutely see the community pharmacist and pharmacy as an opportunity to be able to deliver more services to patients. So, for example, today it's primarily a phone-based app, but at the same time, we're matching and can match based on proximity and location. And actually a part of the onboarding personal information is the pharmacist can enter pharmacies that they are affiliated with, and we can use that to match them closer to patients. And we envision that in the near term, it won't just be a phone service. We'll have pharmacists meeting with patients in their pharmacy, just using the app as a connection point to deliver services, or even potentially, obviously with the patient's HIPAA consent, to meet at Starbucks or meet at Panera to deliver a comprehensive medication review, or the church or the community center, where they can create that personal relationship and really spend some quality time together. And at the same time, for the community pharmacist, there are obviously other services, for example, a flu shot, a cholesterol check, or other tests that can be delivered by the pharmacist, where the pharmacist can say, oh, and I'm working at this store at such and such time, why don't you come here, we'll get that flu shot taken care of you, or whatever other services is needed.
Do the pharmacists have to have an existing relationship with the healthcare organization to, quote, show up in the match, or do pharmacists operate independently?
The pharmacist operates independently.
And would the services be similar to Part D MTM services, but for health systems rather than Medicare beneficiaries?
Actually, currently, they are comprehensive medication reviews within Medicare Part D. We see the opportunities expanding to transitions of care, medication reconciliation, chronic care management, specialty medications, where a pharmacist, for example, may have gone through there might be a required course, as is mentioned in that California example, where the pharmacist has been trained specifically on the specialty medication, how to administer it, what side effects to look for, or whatever else is required. The pharmacist could then go meet the patient in their home and manage the specialty medication delivery as well, and get a more personalized service and better one-on-one care utilizing the pharmacist.
All right, here's a three-part question. How much does the pharmacist pay to join Aspen RX? Second question is, how much could a pharmacist make per patient consult? And what about malpractice insurance?
So the fee is $75 to join the community, and that helps to cover the cost that we have of some of those onboarding steps, and putting doing those background checks, et cetera. It's a one-time fee. And there's also continuing education. For example, we provide 8 hours of CE on motivational interviewing. It's an over $200 course if someone was buying it on their own, and we provide that for free because we want to help enhance those skills and deliver quality services. Initially, in our first pilot, pharmacists were making over $75 an hour in the initial set of patients. We're just getting ready to expand across Florida, actually in the next week, and there will be $480,000 we expect worth of opportunities, for example, for pharmacists to pursue in delivering services. And as we expand and bring new opportunities in, that number will just grow. And then on the insurance, pharmacists are independent contractors, so they should have their own liability insurance. We are working on some partnerships to be able to provide easy access to that, and hope maybe even reduce rates. But that has yet to play out, but definitely would recommend that.
So one more question. Does the pharmacist have to be licensed in the state where the patient is located?
Yeah, that's a great question. I think it's been a gray area that's been kind of hanging out there in the profession since MTM started. And I think depending on which side of the aisle, if you ask, you'll get a different answer. I think many people would say it's not black and white that you have to. I think oftentimes the state boards may disagree with that and have a different interpretation. We're saying, at least especially out of the gate, that yes, especially because we have the capability with pharmacy profiles to make it much more manageable, that we can set that as a criteria to say you have to be licensed in the state the patient is in. We have pharmacists with multiple state licensures. And so you don't have to physically be located in the state, although the match is based somewhat on proximity. So if you are, you'll have a better match. However, in our model, every pharmacist sees every opportunity. They're just sorted differently based upon clinical match, and we'll be able to refine that as we get more data and learn over time.
So here's a few more here for pharmacy profiles. Are you planning to work with state CPESNs to consolidate the credentialing process for those pharmacists/pharmacies?
Well, we've been in close discussions with CPESN for some time. We're still working out what our relationship will be, but those discussions have been very productive and they're continuing.
Right. And how would a patient be directed to contact one of the pharmacist providers through the Pharmacy Profiles Network? Is that a possibility? Would patients have, a role in this?
So at this time, the pharmacist profile is not visible to patients. Right now, it is visible to the pharmacists themselves, and then the employer or the payer with whom they're affiliated. On the roadmap, we certainly have thoughts about, making that visible and having pharmacists be able to look up, patients looking up pharmacists who might have certain skills or what have you. But at this time, it is just visible to the pharmacists and those that they contract or are employed by.
So here's a question that kind of goes to kind of both the focus and the branding of pharmacy profiles. The question is this pharmacy profiles or pharmacist profiles?
That's a good question. We are basically a subsidiary of APHA. We are thus a very pharmacist-centric solution. But we also realize that the world in our marketplace is very pharmacy-centric today. So the short answer is we are both, and we link data up to pharmacies, individual pharmacist data to pharmacies. We link pharmacies and pharmacists to networks and to health plans and to others with whom they work. So we are essentially all about the pharmacy profession ultimately, and that means we're really about pharmacies as well as pharmacists.
Right. And just to add, like our products or our services, if you will, our company name is Pharmacy Profiles, kind of thinking of pharmacy at the highest level, the practice. And our service for pharmacists, we call the Pharmacist Profile. And then our service for the payers and employers, we call Credentials Verification Service. So sometimes people nickname us profiles, but there are names underneath for the various services.
Yeah, I think part of the reason also for saying pharmacy is there's, as you mentioned, the opportunity to include technicians down the road and technician certification, and so credentialing. And so that would be limiting. Pharmacists would have been limiting from that, and just to keep it more open, was Pharmacy Profiles was chosen.
All right, so we have time for one last question here, and I will email you guys the additional questions. We've had a lot of questions come in, haven't been able to get to all of them. But the last one is, how often do you check the credentials of the pharmacist after they initially enter the system?
Our service, we check the data is updated pretty much in real time in our system, but in terms of the actual credentials verification that we offer to employers and to health plan and others, that's basically a quarterly verification of that data. As I said, we do actually update the data much more frequently. And if we have a business partner who wants the data to be verified more frequently than quarterly, then we certainly are adaptable and will do so.
All right, well, we are at the top of the hour. I want to thank Todd, Jill, and Brad for today's presentation, as well as the audience. Again, we've had a lot of questions, a lot of interest in this. So I will share the questions with the presenters, and they can reach out individually as appropriate to provide additional information. So thank you again for today's session. Also want to remind everyone to take a couple of minutes to complete the survey that will launch at the end of the webinar. Again, your feedback helps us select future topics. And then again, just join us in August for our next Quality Forum webinar. That will be on August 8th, and invitations for that, registration links will be distributed in the near future. So thank you again. Have a great afternoon, and goodbye.